Okay, so that's section 4, line number 45. And if we go to the data itself, 445 is the field we are interested in. And what we want to do is insert a column, just as we did before. So we want to click on GA, right-click, click Insert, and we've inserted a column. And what I want to know is the percentage of patients, so I'm going to do percentage, that left without being seen, LWBS, right? And so we know that the numerator is going to be this column FC, which is registrations that didn't get treatment. And then the denominator is going to be the total ER traffic. So we're going to make that equals, we're going to make that FC2, or I could have just, I'm sorry, FC3, or I could have just clicked on it, over. Then we're going to click the denominator being the total number of ER visits. And then we're going to click Return. And then again, we're going to drag this all the way down. And I dragged it too far. And stop there. The ones that have, again, errors are ones that don't have emergency rooms, so they don't have any ER traffic, and that's why you'd see that error. I want to change this again to show it in percentage terms, so I'm going to highlight the whole column. And I'm going to go to Format Cells, Percentage, and hit OK. And then I want to sort this. So I'm going to go right back up here to the top left corner, hit the triangle, go to Sort, percentage left without being seen, largest to smallest. So again, these are people who went to the emergency room, checked in, and then left before they were seen. We again start with the error messages. Once we get past those, however, we see that here at Kaiser Hospital, Sacramento, 42% of the patients who showed up and registered left before they were seen. That seems to be a pretty high number. And when you look at the list here of hospitals that have the high left without being seen figures, the top 6 hospitals are Kaiser hospitals. I don't have a good explanation for that. I don't know why that would be necessarily, unless perhaps a patient shows up, doesn't have Kaiser insurance, is not seriously ill, and chooses to go to a hospital that accepts their insurance. That would be the only thing that I can think of, and I'm certainly willing to entertain any thoughts that you guys may have about why that would be. But I would want to ask some questions about that, because an awful lot of people are showing up to Kaiser emergency rooms in the state and leaving without being seen. So I think that this is an important question that one of you, I'm hoping, will take on. You also will want to look and see, by doing this calculation on data from, say, 2008, whether this is the same as then or whether there's some glitch in Kaiser's data reporting. But when you get past Kaiser, Long Beach Memorial Medical Center, 16% of patients are checking in and leaving before they're seen. These are big numbers, folks. And when you go to the pivot tables and you want to see the left without being seen, you will see, if we have the whole state here, which I believe we do, 482 hospitals, that there were 11,700,000 ER visits and 443,000 patients left without being seen. And so if you do the math, that comes to about 3.8%. So when you have hospitals that are in the 16% range, you know, that's worth questions and whether or not that hospital is serving the community that it's intended to serve. And I'm hoping that, as with some of these other fields, that showing you how to do this, how to add columns where you can calculate this information, will give you ideas of questions that you want to ask hospitals in your communities and public health experts in the state of California, so that you can be, you know, watchdogs for the care that's being provided in your communities and ensuring that it meets the needs of the residents. So with that, Michelle, if there are any questions, I'm happy to take them, or I'll turn it back over to you.
Yeah, let me just take a look and see. Anybody new want to raise your hand? Or you can click on the hand icon, or you can click on the question icon and type in a question. Okay. Well, we'll wait another couple minutes, Charlie, just to give people a moment. Once again, these icons are in the upper left-hand corner of your dashboard. Here's a question from Mark Zochi. Are you aware of any other similar statewide databases that might have similar info as OSHPD? And I think that's in the tip sheet that Charlie prepared, but he'd also suggested that you could call like your hospital association or something to find out. But Charlie, did you want to add anything on that?
Yeah, I would say the first place that I would start with is calling your state health department and asking if they gather information from billing records, or that if hospitals have to fill out forms about their finances and utilization of services, and whether they do that or the state hospital association does it. OSHPD is a different agency from the State Department of Public Health, and so you would call a different agency for this information. So, but the state health department should know where to send you to ask.
And then Lindsay McCormick says, this was an awesome explanation of how to use this data. My question, how do you identify similar databases in other states? I think we've just answered that. She lives in New York, but I think Lindsay, hopefully his answer will help you with that. And then we have a question from Philip Greatzer in Atlanta asking Charlie whether you've done any analysis of patient demographics, age, sex, ethnicity, county of residence using this database.
I haven't, although it's certainly possible. And I think one of the things I should have mentioned at the beginning is in California and in other states, you can buy a public use file, is what it's called, of every patient claim filed by a hospital over the course of a year. And so what California Watch and others have done, Marshall Allen did when he was at the Las Vegas Sun, is using those, the billing data of every patient seen in the state. You can do an awful lot of analysis with that. That requires much more statistical knowledge. It requires much more database knowledge. What today's discussion is sort of intended to do is give you an introduction to things that every reporter should be able to do with minimum tools. And so there are public use files of billing records, and those are hundreds of thousands of files in some states per year. And so you should ask if you can get those if you know how to use, more powerful analytical programs.
We have another question here from Lindsay McCormick. She says she'd love to hear your tips on getting candid appraisals and the reasons why certain hospitals have high C-section rates, heart stent rates, and how you go beyond the PR office and reach out to the doctors themselves. I know you had talked about talking to the specialty organizations to get their sort of metric, but are there other suggestions you have for Lindsay?
Well, in terms of why a particular hospital C-section rate, may be higher, it's certainly most hospitals have doctors that practice there that also practice at other facilities. Kaiser certainly does not, but many facilities have physicians who practice at more than one hospital. And so I would try to talk to physician leaders in the community. Sometimes they can just give you, suggestions or tips. I would also talk to perhaps pregnant women going into the facility. And it's pretty easy to spot somebody who's, 8 months pregnant who's going into a hospital. And if you're standing in a public space, you have every right to do so and to ask people questions. And hopefully by just you could also go to, say, a nursing store in the community that sells nursing supplies to talk to mothers who've recently delivered and ask them whether they had C-sections or natural or vaginal births. And if they felt pressured to have one or the other. So I would just sort of be creative about using the resources in your community to help identify mothers and physicians who that you could talk to.
So, Charlie, we have just really a couple minutes left, so I just wanted to share one comment and one question. Ryan McNeil of the Dallas Morning News says he regularly buys the discharge data, and he thinks that it's one of the best data sets ever. And then Karen Karp says, is state data available for morbidity, mortality, and closed claims?
So, Karen, I'm not super familiar about the exact information that's included in the Uber billing data set. I do know that when they're doing analyses of quality, they're using that data. I believe that you would know if the patient died during the stay or didn't die during the stay, although I can't be 100% positive on that because I personally have not used that. That's a good question to ask of David Burns at OSHPD. I had two more quick things to say. The first was people can feel free to drop me an email charles.ornstein at ProPublica.org, which is on the tip sheet if you have any questions from this. And also, Christina Jewett and I will be doing a hands-on, in-person sort of version of this at AHCJ's fall workshop in October, covering the business of healthcare in San Francisco. So if you're interested in seeing this in person and working with this data, which I think we'll probably be using more so the financial data for that one, you certainly are welcome to attend, and information is available on AHCJ's website for that.
So I want to thank Charlie for this wonderful and really clear explanation and going through all these tips on Excel as well. I want to remind all of you that we'll be sending you in an hour a very quick set of questions in an evaluation form, and we really encourage you to fill that out. It really helps us decide what we might do next. And also to let you know that we'll have pages with all these resources on both reportingonhealth.org and the Association of Healthcare Journalists website, and that you should also explore some of the other educational and learning resources and tip sheets offered by both websites. We're really both in the business of helping journalists do their work in the most sophisticated ways they can, and so take advantage of what we have to offer. And with that, I want to thank all of you for your great questions and participating. Charlie, did you want to say a final word?
Just thank you, and I would love to see the stories that you may do using this information. I know we're all interested in seeing that you guys do great work, and hopefully this has been useful.
You can email us with the stories you do at editor@reportingonhealth.org. And is there a quick email for Pia at HCJ, Charlie, if folks want to share with HCJ?
Yeah, they can send it to pia@healthjournalism.org, or you have my email address as well. Feel free to drop it to me as well.
And it's PIA for Pia. Thank you.
Exactly.
We're going to let you all get back to your day, and we look forward to hearing of your good work. Thanks so much for joining us.
Thanks.